Hello everyone, you're watching sqadia.com and I am Hammad Haider. Today our topic is spinal cord injuries or spine injuries. As we will have three sections in this topic, and in the first section we're discussing the different factors which are lead to stable and unstable fracture. We'll be briefly discussing the Dennis theory of columns as well. What is interior column, middle and posterior column, and how it affects the stability in the fractures of the spinal cord. Then we will discuss this classification. Then we will go to the pathophysiology. What is the mechanism of injury? How can the spinal cord be damaged? What are the different forces which can act on the spinal cord during the RTA or during the trauma incident, and how it actually affects the fracture geometry. Then we will be briefly discussing the healing mechanism of the fractures and the ligaments as well, and discussing the early management as per ATLS protocols, what we need to do when we have a spinal cord injury patient, which may be also be a polytrauma patient as well. And when it comes to polytrauma along with spinal cord injury, then there are certain guidelines like ATLS guidelines that has to be followed for proper management of the patient. Then in the second section, we will briefly going through the classification of the spinal fractures, how to diagnose them, what are the different, how it starts with the history, then general examination, the neurological examination, how to assess it, especially the how to rule out the spinal cord dysfunction or complete neurological injury, and from the spinal shock, what is sparing in the spinal shock, especially the sacral sparing. And then we'll be briefly discussing all that along with the imaging, what images we need to get, what is the role of X-rays, CT scan and MRI in acute and chronic spinal cord injuries. And then we'll be briefly going through the definitive management of the spinal fracture management in the third section. We'll be discussing the principles of definitive treatment, patient without any neurological injury and with the neurological injury, and what fractures actually require stabilization, what requires conservative management, and what are the different treatment methods available for different type of spinal fractures. Thank you very much. Keep watching sqadia.com.